AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor. I'm Lorena Anderson, your life and energy coach. This is being presented by AMP2 TV and also All County Healthcare, our sponsors for this show. You can find us streaming live on allcountyhealthcare.com and also amp2.tv. That's AMP, the number 2.tv. You and Your Doctors. So welcome tonight. I do want to let you know that we would love for you to participate. So please give us a call. If you have any questions whatsoever, our number is 888-565-1470, 1470. Give us a call. We're here to help educate and inform you so that you can make the proper choices when it comes to your health care. Especially when you're hitting Medicare age, it's extremely important to know what your choices are and to be able to make clear, concise choices when it comes to the plans that you're planning on subscribing for. So welcome again. It's great to have you. We've got a couple great guests as usual. And I'd just like to say thank you again to All County Healthcare for sponsoring this because they bring in the professionals that can help keep you educated and informed about your healthcare needs. So tonight we have Dr. Robin Shecter.
That's right.
And she happens to be a dermatologist. So, but she's got something a little special. She said that she wasn't going to do it tonight, but we might be able to convince her. She's called the singing dermatologist. So I was told that in her office and also in surgery or wherever she might be, you'll hear her break out into song. So she loves Broadway. So welcome tonight.
Thank you so much.
It's wonderful to have you.
It's great to be here.
Tell us a little bit about you, your dermatology center, where it's located.
I'm in private practice. I actually have another doctor with me, Dr. Marin. I have two locations. One is in Lake Worth and one is in Boynton Beach.
Okay.
Addresses?
Yeah, sure.
The address of the Lake Worth office, it's on the corner of Lantana and Jog, 5808 Jog Road, Lake Worth. Phone number is 561-968-7546, or an easy way to remember it is 561-968-SKIN.
Okay.
Boynton Beach is 7410 Boynton Beach Boulevard, Suite A2. It's in the Flakowitz Shopping Center, 561-742-2252. I'm in both offices.
Okay.
And I have hours in the evening and also Saturdays.
Oh, wow. Well, that makes you different already.
Yes.
That is wonderful.
Thank you.
Well, it's wonderful to have you here because, as we begin to age, there's a lot of things that end up happening with our skin. So share with us some of the major concerns as we continue to grow a little into our senior time.
The main concern, especially living in South Florida, is skin cancer.
Really?
There's an epidemic of skin cancer, melanoma being the most deadly of all the skin cancers. Believe it or not, most of your sun damage occurs before you're 18 years old. So It's not what we do yesterday or today. It's not my 80-year-old patients that are diagnosed with skin cancer stating to me they haven't been in the sun in a year. It's what they did before when they were a teenager.
Yeah.
I know I grew up, as you probably can tell, I'm from New York, Long Island. How many New Yorkers do we have in the audience?
I love it. Yes, absolutely.
And, I definitely have an accent. But we didn't know back then. I used to fry in the sun. I would drive to Florida with my family the day before I went back. Baby oil, SPF 2.
Oh, God, I know.
And I got blistering sunburns, so I'm worried. And actually, a dermatologist, when I first moved here, said I'm a skin cancer waiting to happen because I really abused my skin growing up. I didn't know any better.
I didn't know that. That's very interesting that everything happens before you're age 18.
That's right.
I
80%.
I grew up in Chicago, so I would lay out all the time. Yeah, I had my little pad, the reflector pad, and then I put water on top of it, and then I'd lay on that up on the ninth floor where I was living. So it never occurred to me, oh, yeah, baby oil with a little iodine in it.
We just didn't know back then.
I know. Okay, well, we weren't educated
That's right.
in a lot of that. So
that's why we're seeing a lot of skin cancer. It's actually the most common cancer next to breast cancer, lung cancer. The most amount of cancer we get in the United States is skin cancer.
Wow. Well, that's really interesting. So, do you find then if we're running into our skin that is so damaged before the age of 18 that what you do now in the later stages in our senior years or whatever, does it really make that much of a difference then?
You still have that 20% that you can improve. I strongly believe in antioxidants. I recommend retin A, vitamin C for the skin. One thing I'll bring up is every tanning bed should close down.
Really?
There's no benefit whatsoever to tanning beds. And one exposure in a tanning bed can greatly increase your risk for melanoma.
Wow.
So the population should never, ever go step foot in a tanning bed.
I had always thought that as well. And of course, when I was in my 30s and 40s and I'm still living in Chicago, that happened to be a very easy alternative than laying out in the sun. And not only that, I had this wonderful little thought process. I was like, well, there's only 3 months of summer in Chicago. I can only lay out 2 days a week. Let's see, what is that? 2, 4, 6, 8 days, a whole month, 21 days a year. Oh, no, I think I'll be fine. And I used to rationalize and justify that all the time.
There's no justification to go in a tanning bed.
Oh,
I just toured a health club I was considering joining. And the first place they took me to on the tour was a tanning bed. And I said I'm going to go the opposite way because there's no benefit whatsoever. Spray tans are okay. In moderation, you don't want to avoid the sun, but you have to protect your skin. And what I recommend, and I could talk a little bit about sunscreen, I don't like sprays. Sprays have a lot of alcohol and air, and they're not very effective, and they're also not good for your lungs.
Oh, okay.
So I tell people I don't recommend the spray sunscreens. Gels are okay, lotions are okay, creams are okay. You want to look for SPF 30 up to 50. After 50, it becomes redundant. You really don't need a higher sunscreen than 50, but you want it to be at least 30. Broad spectrum is really important because that's the UVA, UVB, the burning rays. So you want to make sure a sunscreen says SPF 30 or greater, and the words broad spectrum are really important.
That's the first time I've heard about that. Broad spectrum. I've not heard of that one before.
For that, broad spectrum.
Oh, okay.
You want to put sunscreen on a good 30 minutes before you go in a pool or the beach. And you definitely want to reapply every 2 hours. Very important. You want to cover your scalp, sunglasses, a wide-brimmed hat, because we see a lot of skin cancers on the tips of the ears. In older people, thinning hair, we see a lot on the scalp.
Oh,
so
yeah.
I definitely recommend not a baseball cap, but a wide-brimmed hat that covers the ears. Sunglasses, sunscreen. The burning rays, the most dangerous time to go out is between 11 and 3. That's when you have to be extra careful. I was a lifeguard at one time, and I used to think on shady days, oh, I don't need sunscreen. But I used to get blistering sunburn. So even when it's shady, rainy, you still need sunscreen.
Wow.
And you must reapply, like I said.
Yeah, every 2 hours.
Yes.
Okay.
So that's really important. And water resistant up to 80 minutes. There's no longer, I invented a sunscreen that I could talk about at a later date. When you buy a sunscreen, look for water resistant. It's not going to say waterproof anymore. It's going to say water resistant.
Okay.
And sunscreens are tested, and the highest is going to be up to 80 minutes. So that's important too.
Yeah, that is. Well, that gives you your 2 hours then before you reapply again.
PABA, parabens, you want to get free of those two ingredients. And that's about it. So just be real careful. make sure kids from the age of 6 months and up always wear sunscreen. So it's 6 months and up. It's very important to start using it.
Well, you were talking also this one particular sunscreen that you developed.
Yes.
What was the key ingredient? What did you see that was missing in all the others that enticed you to create it?
I'm in the process of remarketing it with a different name, but the main thing I went after is that children don't like to wear sunscreen. A lot of the sunscreen, you put it on and you look like a ghost.
Right, it's all
They're
white
and thick.
Yeah.
So this was a fun sunscreen that dried clear and it smelled good and all that. But that'll be at a later date. I'll bring in a bottle once I repackage it, and I'd like to do an episode on that.
Oh, cool.
So,
yeah, that sounds wonderful. That sounds like a great time.
But just look for creams, gels. No,
Yeah.
I don't like sprays at all. I know from personal experience, I tried to spray one time on a friend's boat. I fried, even though I reapplied it every 2 hours.
Well, that's really interesting as well, because I've always kind of, wondered how well that really does cover. And I've had some friends out on the boat, because we have a boat. So I've had some friends out on the boat, and he said, I've been putting on this spray once an hour, and I'm still fried.
That's right.
But now I understand why, because
and for the lungs, it's not good. And I'll bring this up. Talcum powder, same thing. I guess when people have excess sweating, talcum powder causes cancer. Specifically, they mention ovarian, but anyone that uses powder to stay dry, get rid of the talc.
Wow.
So that Johnson,
I
don't know if I give names, but
we don't want to give names.
I don't want to give names, but anything with talc, definitely try to avoid.
Wow, that's very interesting as well. I heard some rumblings out there in the in the news broadcast and everything about talcum, right?
That's right.
Yeah,
talcum powder
not being healthy, and
it can cause pulmonary fibrosis and different forms of cancer.
Oh my goodness!
So even if you think you're not breathing it in, it gets aerosolized. So when babies have diaper rashes, use something else. Don't use talc.
Wow, that's interesting. And grandparents, that's for you too. No more talcum powder.
Right. That's right.
Yeah.
So I talked about also sun protective clothing. Very good. My kids, I have a daughter that's 15, and all the teenagers want to wear young girls' bikinis. So I plead with her to wear like a sun protective shirt, because a lot of them miss their shoulders and their upper back. So I'm really a fan of sun protective clothing.
Yeah. Oh, okay. Okay, great.
I have a son that's 10, and he is very good about wearing the long sleeve UV shirts.
I've seen those before, and they do a great job. But I can understand some of the young ladies not really wanting to cover up the bikini.
That's right. It's a struggle with my teenage daughter to wear a sun protective shirt.
Yes.
So
yes. I bet you she says, "It's okay, Mom. I'll put on lots of sunscreen. I promise."
And then she comes home and she does a good job, but she usually misses her shoulders and her upper back. And after a couple of bad sunburns, you think twice about going out without, sunscreen and a shirt.
Yeah. Well, and you bring that up. I remember as I was growing up, I would, the very first day, Memorial Day, I was out at the beach, and I lived right next door to the beach. So I'm out there, and I've got to tell you, first sunburn of the year. And I would peel. I mean, you could honestly smell the skin burning on my body. And then it would peel. But then after that, no problem whatsoever. I would stay out days at a time. And, the next day it'd be all tan again. So I know
People
better
don't
now.
realize this. There's also no healthy tan. So even if there's different skin types, Fitzpatrick 1 to 5, 1 is always burns, never tans. That's me. And then darker skin, usually tan, never burns. There's a spectrum. There's still no healthy tan. I have the worst skin to be in South Florida. They always burn, fair skin, blue, light eyes. I'm most at risk for skin cancer, but everyone, no matter what skin type they have, has to be careful and wear sunscreen.
That's very important.
Very important.
Yes.
I wanted to talk about
How about
what to look for.
Okay, good. Excellent.
There's three main types of skin cancer. There's basal cell carcinoma, squamous cell carcinoma, melanoma. Basal cell carcinoma, the most common sun-exposed areas, then squamous cell carcinoma and melanoma. Usually, basal cell carcinoma does not metastasize or spread internally, but squamous cell carcinoma can spread internally, and we definitely know melanoma can.
Yes.
The bottom line is, dermatologists, we know what to look for, but if you have any lesions that are crusting, bleeding, not healing, keep recurring, see a dermatologist. Melanoma, you look for the ABCDEs, the asymmetry of a lesion, irregular jagged borders, multicolored. Melanomas can be pink and black, gray and blue, tan and brown. Diameter, they usually start the size of a pencil eraser. And once they're elevated, E for elevation, that's when they usually spread internally. Melanomas start flat. First you have radial spread and then you have vertical spread. And when they grow up is usually when they metastasize. So if anyone has a history of skin cancer, I want to see them every 3 to 4 months. Melanoma, you need your eyes checked, your inside. Melanoma can be anywhere. By the way, that's usually the most deadly skin cancer. That's what we're afraid of. And we look extra hard to diagnose melanomas.
Gotcha.
Everyone should have their eyes dilated once a year because you can get melanoma on the retina.
Oh, my goodness.
Inside the mouth, under the tongue.
Wow.
In between the toes. A good dermatologist should look at the feet in between the toes. Even in your private areas, you can still, it's genetic too. Even when there's no sun exposure, you can get melanoma. So it's very important to have complete skin exams without a history of skin cancer once a year, with a history of skin cancer a lot more often.
Gotcha. That is great information, because I have heard of melanoma, and it showed up in an area that was never exposed to the sun whatsoever. And I did hear of another case where it was in the retina, and I was shocked.
You can get it. That's why your eyes should be dilated once a year. It's pretty scary. There's also something called an amelanotic melanoma. So melanoma is without pigment. If you have a pink spot, and even if it's not black, like you think a melanoma is black, you can have something called an amelanotic melanoma without pigment. Those are particularly hard to diagnose. It can look like a patch of psoriasis and be a melanoma. So the bottom line is, if you have something, a month goes by, not healing, crusting, bleeding, patients come in all the time and they say, I thought I got bit by something, but this thing just won't heal. Make sure a dermatologist takes a biopsy of that. Very important.
Wow, excellent. Excellent advice. So, audience, this is now the time. If you have any questions for Doctor, please give us a call, 888-565-1470. She's ready to answer any questions that you might have, and especially about the skin cancers and also the sunscreens and how to apply them and the amount of time that you need to reapply, and also, waterproof sunscreens as well. And I'd also like to say thank you very much to All County Healthcare for bringing us these doctors to help teach us and educate us about the various diseases and problems and cancers that we could encounter as we continue in our senior years. So wonderful, wonderful information. Well, can you talk to us about keratosis?
Yes. There's something called an actinic keratosis, which is precancer. So especially, I would say, in older men and women, when you get those rough spots on your scalp, make sure those are treated. We use dry ice or liquid nitrogen, creams, something called a blue light treatment, which is not ultraviolet light. You really want to treat those actinic keratoses or precancers where they can become squamous cell carcinoma. So those rough spots you feel on your hands, your arms, scalp, face, get those treated by one of the methods I mentioned.
Okay.
Very important.
Wow, that's very good information as well. Because sometimes you see the elderly and they have the little rough patches or whatever. And one of my clients, he was 90 years old, and he would go in almost like once a month to have them removed.
Yeah,
he had them all over his face.
And there's different methods that we use to remove them, but it's important to treat those actinic keratoses.
Okay. Okay, great. So, you said that cancer, your skin cancer is on the rise, almost an epidemic.
Yes,
Which
there is an epidemic.
Okay. Which skin cancer is that?
Melanoma, but
Really?
all of them. But melanoma is the most dangerous, I would say, of all the skin cancers. Basal cell squamous cell melanoma, the most, well known, but there's a lot of other types of skin cancer. Another thing I really want to bring up is when you get your nails done. People don't realize, but those drying lights, when you get gel tips and acrylic, those are ultraviolet lights.
Mm-hmm.
So that's like putting your hands in a tanning bed.
Really?
So I tell my patients, when you get your nails done, air dry, use a fan, do not put your hands in the lights.
Wow.
I've heard of patients, patients that realize that these are ultraviolet, they use sunscreen on their hands. But if at all possible, avoid those lights.
Well, I know with a lot of the gels, you have to have the lights or it never dries.
Yeah, there's other types of manicures that don't use the lights, and I'd recommend those. There was something else I wanted to bring up. There's something called Hutchinson sign. If you get a stripe of black or brown under the nail, pigmented stripe, that could be a melanoma under the nail. So I always tell patients when they get a skin exam, take off your nail polish. If you see any pigmented lesions under the nails, those could be particularly aggressive. So if there's any manicurists in the audience, look for that. If someone has anything pigmented, make sure they go to a dermatologist.
Excellent. Excellent. Well, I've got to tell you, you're really bringing out a lot of really insightful information for the audience members. So please keep this in mind as you're, going through your day. And also, please make sure, why don't you give us your name again, not as if we don't know your name, but where we can find you and your telephone number, and a little slower so that they can get a piece of paper and pen and write it down.
So I typically speak fast. But I'm Dr. Robin Shecter. I'm in Lake Worth and Boynton Beach.
Okay.
The Lake Worth office, easiest way to remember it is 561-968-SKIN.
968.
SKIN.
Okay. I'm
SKIN. Boynton Beach is 561-742-2252. We have hours during the day, evenings, and Saturdays. And the unique thing about my office is when you make an appointment with a dermatologist, you will see a dermatologist. A lot of offices you go to, you don't know who you're going to see. But in our office, we also take more time with patients, I would say. So you will get individualized attention, and you will see a board-certified dermatologist every time you come to the office.
That is wonderful. That is really wonderful. And not only
and
that,
for no
but
extra charge, I'll sing for you.
Yeah. There you go. You got to come see her.
And we take most insurances.
Oh, that's incredible. That's great. That's great. I can see it now. There's nothing better than hearing a beautiful voice coming from...
All right, I'll sing a line, which is pertinent to dermatology.
Okay.
The sun will come out tomorrow. Bet your bottom dollar that tomorrow there'll be sun.
Beautiful.
Thank you.
Yay.
Related to dermatology. I had to throw that in there.
I love it. That's one of my favorite songs, too.
We all like Danny growing up, right? Especially New Yorkers.
Absolutely.
So.
Well, one of the things that I'd like to talk about also is the Mohs. I hear a lot about that, and that's spelled M-O-H apostrophe S. Okay, micrographic surgery. Could you, describe that? Because I've known of other, individuals who have had it, and boy, I've got to tell you, they have to really dig it out and left big holes and everything. So share with us.
Mohs micrographic surgery was named after Dr. Frederick Mohs. And it's actually tissue sparing. It's not for every type of skin cancer, but certain types of skin cancer, such as recurrences on the face, certain areas, Mohs surgery is actually a very good treatment and very successful. A Mohs surgeon is a dermatologist with extra training in the specialized surgery.
Okay.
I have a Mohs surgeon in the office. And what it is if you have a skin cancer, a piece of tissue is cut out, prepped, looked under the microscope to see if the margins are clear. And if not, another cut is taken. So it's layer by layer.
Oh, my goodness.
So if you have Mohs surgery, you wait in between cuts. So the dermatologist, Mohs surgeon, takes a piece, checks under the microscope. If it's clear, you're done. Mohs surgeon comes back, closes you. Or you can be sent to a plastic surgeon for the closure. If it's not clear, it's another layer, and it's layer by layer till it's clear. So it's tissue sparing. So if you ask me how wide and deep the scar is going to be, we don't really know till we get in there.
Wow.
So that's what Mohs surgery is. It's a really effective, good way to remove certain skin cancers.
Wow, that is very, very interesting, because I have known of certain individuals, like someplace on the nose, and all of a sudden, there's huge tissue that is gone because of that.
Yeah, so, luckily, a lot of times Mohs surgery can be done in one stage.
Mm-hmm.
Sometimes it could be 2, 3, 4. So, and then if you have a big enough hole, you may need a flap, graft. They move tissue to close it. Sometimes you need a graft where something is taken either from your skin and put on that area to close it if it's too large a defect.
Gotcha. Well, I want to thank you so very much, Dr. Shecter, for
being
here, for informing us, for informing our audience. It has been a pleasure.
Thank you so much.
Oh, thank you. And we're going to break for commercial at this moment. Thank you again, All County Healthcare, for bringing this segment together and bringing on our doctor as well. And we'll be right back. Stay tuned. Don't leave us.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, your life and energy coach. And also, this is being presented by AMP2 TV and sponsored by All County Healthcare, where patients are the heart of their business. One of the things that I'd like to let you know is that we are streaming live. So you can go on allcountyhealthcare.com and see us live on TV, on the internet TV, or you can go to amp2.tv. That's AMP the number 2.tv. You and your doctor. So we have another guest, another doctor, and I am so pleased to welcome
Thank
Dr.
you.
Holzworth.
Thank you.
She's a podiatrist, and we're going
Nice
to
to
talk
meet you.
all about feet
Yes.
and health, the care of your feet, why it's so important to take good care of your teeth, and other things too. Yeah, absolutely.
Sure.
So, welcome. It's great to have you.
Thank you. Thank you. Thank you for having me.
Our pleasure. Our pleasure. Tell us a little bit about you. What inspired you to become a podiatrist?
Oh, my grandmother's feet, actually. My grandmother had the worst feet in the world. And
Really?
yeah, growing up with her and seeing her struggle on a daily basis definitely encouraged me to look into a field that as podiatry. So
Oh,
yeah,
that's very
pleased.
interesting.
Yeah, I was very fortunate during my undergrad training to shadow many podiatrists who were very successful and very happy with what they did, and they channeled me into the field. So it was really nice.
That's wonderful. When did you realize, at what age did you realize that might be one of your passions?
Probably 22, 23. Yeah, right at the end of college.
Oh, okay. Okay, great.
great.
And before that time, feet were just something you put
Medicine
pretty
in general.
Okay,
Medicine
okay.
in general.
I was going to say
Yes.
just something you put pretty shoes on, right?
Right? Yes. Yes.
Oh,
Yeah, medicine in
beautiful.
general.
So, what is the experience like to be a podiatrist? Share with us a little bit how
That's
how
an
that
interesting
is.
question. I actually had a pre-med student in my office today, so that's a great question. It's great. And podiatry, we get to do a lot of things that incorporate foot and ankle. And everything from dermatology to orthopedics to sports medicine, some pediatric cases that we treat. So it takes care of a lot of many different niches within medicine that actually we can help our patients on a daily basis. So it's very
Excellent.
good.
Well, tell the audience how they can get a hold of you.
Well, my office is located in Boca. It's
Okay.
on 660 Glades Road, and phone number is 561
Slow.
391 5515. And our office website is actually www.brog.com. So
BROG.
BROG for Boca Raton Orthopedic Group.
Oh, okay. Excellent. Excellent. Beautiful. And do you have a website? That
Yeah,
website?
our website has different profiles for all the physicians. So under physicians, you can contact me directly, but any of our numbers will link me through. the
Okay.
line, so
Beautiful. And so what are your office hours then?
I am there pretty much every day.
Okay.
Every day. Monday afternoons, Tuesdays and Fridays all day, and Wednesday mornings and Thursday mornings. But I'm in the office all the time. So if any emergencies or anything happens, I'm available. So
Oh, wonderful, wonderful. So talk to me a little bit more about some of the issues that you run into being a podiatrist, especially with our senior population.
yeah, we take special care of our seniors in our office. Senior patients are my babies. I don't have any kids, so they are my babies. And a lot of them, the problem is that at advanced age, there's a lot of conservative options that have to be taken care of and looked into before any kind of surgical intervention is to be discussed with them. So given the fact that there's osteoarthritic deformities or peripheral vascular disease from diminished circulation that happens over time, it's very important to take a very aggressive approach as far as conservative management and doing anything that you can to prevent any complications with the advanced age. So in that case, it's in my hands. I'm very aggressive in conservative care and preventative foot issues so that our seniors can keep going without
Yes.
major surgeries or interventions, but having a pain-free activity with daily living. Yeah.
So what are some of the treatments that you do? You say you're very conservative and you really have their best interest at heart. What
Sure.
are some of those treatments then that you do with them, that you help them with?
We have a lot of different ways to go about conservative management for seniors. One of them is physical therapy. We have a physical therapy in our office so they can help them with gait stability, exercises, and strengthening. Additionally, we do a lot of care with orthotics and braces. And I actually, for some of the seniors that have had multiple falls, we have a questionnaire and we go through 20 different questions that I ask. It goes from medications, past medical history of falls or injuries, and if they qualify for, there's braces that we can make in our office and dispense them in our office that help them prevent falls and ambulate more stably. So these are things that they can come to my office and get fitted for, and ultimately these are devices that can prevent the fall or a major injury and give you stability.
Yeah,
So,
that's very interesting.
Yeah, these are great.
And you can do that within your office.
In our office.
That is wonderful
Yeah.
because a lot of times, with our seniors, they don't always have the flexibility of being able to drive from one place to the next. And especially if they're dealing with some injuries already with their feet,
Absolutely.
it's more difficult for them to manage, especially in a car.
Absolutely. Yeah, braces have helped our practice tremendously because, I'm able to fit the patient, get the mold, get the custom-made device in my office and dispense it in my office to make that a little bit easier and more convenient for them.
I love that. A one-stop shop.
One-stop shop. That's the idea. That's the great thing about my office. I work with Dr. Brownstone. He was also here. He's foot and ankle orthopedist.
Oh, yes.
He does work a lot on the orthopedic side of foot and ankle, where I do a lot of the podiatry foot and ankle. So we really work together to enhance our practice and provide as much to our patients in one office. So
that is
we have
wonderful,
our MRI in the building. We have physical therapy in the building. And if somebody needs to be seen by an orthopedist in the same day in the same office, they are able to do it in our office, where it's very difficult in other places. You have to go to different. You can do it in the same day. You can have an appointment with me and an orthopedic surgeon for knee, shoulder, other issues. So
that is wonderful.
It's great.
Wow.
Yeah, I know.
Yeah,
I try to make it as comprehensive as I can, as easy as possible.
I was going to say, no. There's no trying here. You're doing. You are absolutely doing. So that's wonderful to know.
Yes.
Share with the audience again
This camera.
what where your practice is located, so that they can write it down and be able to get a hold of you.
Our practice is located right across from FAU on Glades Road. It's in the Oaks Plaza building, right by CVS, so 660 Glades Road, right next to the hospital, very close to the 95, if anybody needs to take 95 on a major road at Glades. So very easy accessible.
And the telephone number again for everybody.
561-391-5515.
Okay, super. Well, something I've heard a lot about and seen a lot of bunions. Could you explain or talk to us about bunion surgery? Because I know that can be really, really traumatic and keep you off your feet for quite some time.
Yeah. Bunion surgery has changed over time tremendously. There is hundreds of surgical procedures to be done to correct bunions. The most important thing about bunions is when and who needs to get that procedure done. Sometimes the bunion is not so pleasantly looking, but it doesn't hurt. So that's the one main indication that we want to have is pain, disability. Is it really affecting your activities of daily living? Are you really struggling with the bunion? So that's when the indication really comes about, and it's really important to take that into consideration. We also don't want to wait too far to where at an advanced age when circulation is not ideal and many comorbidities are not. We don't want to wait too long to get it done. So if it starts to hurt, definitely take a look at it, have some x-rays done, have your shoe wear to be evaluated, have a biomechanical exam. In that way, you can have a comprehensive approach as far as how to go about surgery. But the surgical advances have changed so much during the years, and the technology these days, it really is amazing. We used to have to keep our patients off their feet for 6 weeks in crutches and walkers. Now the technology is amazing, and we really can help with this new fixation devices to bring our patients back to walking sooner and better, and just helps the recovery.
Oh yeah, absolutely.
And even the anesthesia part of it is terrific because we can do blocks, proximal blocks, like the dentists do local blocks in their teeth before they.
And you can do that on bunion
We can do that on
now?
bunion surgery now. So you can have post-operative pain management for over 12 hours, 24 hours after surgery, and it really makes such a difference in the recovery.
Oh my
so
goodness,
things have
yeah.
changed. The latest technology is amazing. The anesthetic and the preoperative pain management is really wonderful. So things have changed a lot. It's just a matter of finding, are you a really good candidate for this procedure? And
Right.
that's the most important thing.
Well, sometimes I also find that, it might not be painful. The bunion's not painful, but it's so difficult to find shoes
So
to
difficult to
wear.
find shoes.
So, is that considered more than cosmetic versus...
You have to be careful in that regard, because sometimes they really could be that bad that they're starting to deviate the toes, the lesser toes outwards, and you could start getting hammer toes, and the soft tissues can start to change and rupture, and you don't really want to wait till it gets to that point.
Okay.
And so that's one of those things that has to be evaluated. Now you'll talk to your doctor about how it's affecting you, because even if the pain is not as bad, if it's significantly, substantially affecting your activities of the living and your shoes, then surgery might be an option.
Yes, that's what I was wondering, because I noticed that, especially down here in Florida, it's a little bit easier because we have sandals that we can wear.
Yes.
It's not very pleasing to the eye, unfortunately, and it can create some level of discomfort to view it, but you still don't need it surgically removed at that point, because the sandal gives enough room. Yeah.
We actually make custom orthotics in our office, and one of the new things that I started incorporating is custom sandals. So the same orthotic that is built into for a sneaker or for a dress shoe can actually be built into a sandal. So for somebody that needs a custom orthotic, not everybody needs a custom orthotic, but for people who do, then you can actually have the option to make it into a sandal. So it's a custom-made sandal. And the price difference is really not that different. It's really not that bad. It's another great alternative that we have in our office.
That's wonderful.
It's great.
That surprises me. No, that's fabulous. Because in that way, you can still have a really good shoe.
Yes.
And
that's
still
functional.
Yeah. And it looks good. I imagine it looks good as well.
It's a sandal. It's a nice it's a nice handle.
I like a Birkenshire or something like that. Okay, yeah,
exactly.
Everybody loves those,
yes.
Because they're so comfortable and your toes can breathe.
Yes.
Especially. I'll let out a little secret here, but. My feet. First of all, I have very large feet. I always laugh because I say I'm a mermaid.
Oh, you're funny.
Because I
flippers.
I'm
flippers.
Just kidding. No, it's the truth.
I'm joking.
I've lived with these little puppies for a long time. Some of them call them tugboats. But we're talking a size 11. So, I have a very strong foundation, a great understanding, right? I've gotten all the jokes for it. But it's very, very interesting because, a lot of times I end up almost going to the high heels because it kind of offsets the length of the foot.
I see.
But I also know that, you don't want to really be wearing high heels all the time. So talk to us a little bit about that.
Sometimes the reason that you get a bunion to begin with is because you have a very tight Achilles tendon, or sometimes it's just impingement in the interior aspect of the ankle joint. So that limits the range of motion in the hindfoot and the ankle. So to compensate for that, our bodies are amazing. We compensate for all these little things we're born with. To compensate for that, then the midfoot collapses slightly, and that gives a lot of motion to the big toe, pretty much the medial column, the big toe joint. And that's what really starts a bunion to progress and to develop. So
that's very interesting.
Yeah, so that's why a lot of people feel better with a little bit of a heel, because it upsets that drop of the hind foot with the forefoot, and you feel some relief. But the compensation is what you can address conservatively with an orthotic, with a shoe that just lifts up the arch a little bit, prevents that big toe from moving too much, and it prevents bunion.
Well, I've also heard, in the high heels, the more the pointed toe that you have, the more your feet can deform into that.
Those are the worst.
Yeah. No, mine are open-toed.
Okay. Just have a wide toe box. It doesn't have to be open or closed, just wide enough. Sometimes the materials are flexible enough that having just a flexible material gives you a little bit more room, even if it's not a really wide forefoot. shoe toe box. So that could be another tip that you could look for
That's
if you're looking
very-
for a shoe. Just the material. Look for flexible materials. That could
Flexible.
also-
Okay. Well, that's
go,
very
another tip.
interesting. That's wonderful. I'd just like to take this time out to say thank you to All County Healthcare for sponsoring this show and bringing on our Dr. Holzworth. It's just
Thank you,
fascinating.
County. They're
Yeah.
terrific. They're a terrific company.
Oh, yeah,
They
absolutely.
take such good care of my patients. I cannot thank them enough.
Really?
Absolutely. It's great from our doctor's standpoint because we're not there to see your patients all the time. So
Right.
to have a nurse that you can rely on to see your patients when you're not there, it's really amazing. I have a lot of patients with wounds and limb-threatening deformities that it's just so great to have a good team to help you when you're not there at home.
Well,
So,
yeah,
they're really great.
that's awesome.
really-
That's awesome. All County Healthcare, absolutely.
Yes.
That's wonderful. Wonderful recommendation, especially from such a talented doctor as yourself.
Oh, thank you.
Yes.
Kind of you. Thank you.
Absolutely. So, what are some of the other things that you end up seeing when dealing with patients that are coming in, and especially as they're starting to reach more of their senior years? What are some of the other complications that you're seeing?
A lot of neuropathy I see in my office as well. I mean, neuropathy could be from many different etiologies, many different causes. It could be from alcohol, it could be from diabetes, it could be from a lack of vitamins or poor nutrition, it could be from lower back injuries and things like that. So certain types of neuropathy start to come about at their later years in life. There's different kinds of neuropathy. Some of them are sensory neuropathy when you lack the ability to feel. And some of it is motor neuropathy when you have some changes in the muscle and the actual structures of your feet and your body. And some of
Wow.
it is just autonomic when you don't have the ability to protect yourself with sweat. It creates skin changes and sweat changes. So it's autonomic. It's not controlled by yourself. There's different
Okay.
kinds, and that's one of the things that I see a lot in seniors too. And just being fitted for the right pair of inserts or having the adequate shoe care, starting from toenail care, looking in between your toes. If you have neuropathy, you should really be looking at your feet every day and have somebody look at them and cleaning between your toes to make sure you don't have any kind of infection. So senior patients, it's important for them to be aware of that.
Yeah, and also a lot of times I know that, like with my mom, who's senior, she goes there to get her toenails cut.
Sure.
Because I think sometimes fungus grows under there,
Sure.
and it's hard
Sure.
then for anybody to really,
It's hard for us to reach. Imagine
Yeah.
for them, it's harder to get the instrumentation. Sometimes you need a professional, somebody to help you.
Yes.
And again, it's all part of being preventative. You like to prevent an issue before it becomes a problem. So
Absolutely.
if something as little as a toenail is causing you anything, prevent that from becoming a big problem.
Yeah.
Just get it taken care of. Medicare pays for it. It's covered. You have a full comprehensive exam that we can help you with tips and information to prevent issues. So
Yeah, that's very useful information. That's wonderful. The other thing, though, because I'm kind of reaching that elder stage.
we all are. That's a great thing.
I know. Consider the alternative,
Yes.
right? But I'm very active, so I lift weights and
That's great. Very important.
I believe so, especially for the bones, keeping the bones nice and strong and everything.
Circulation.
And circulation, yes. I do cardio as well. But I also know, though, that the right type of footwear is so important. Can you address that, especially with some of us that are reaching that senior mark?
No, stop. For everybody at any
65.
age, trust me, it's important to wear good shoes no matter how old you are. Think about bad shoes as a bad hamburger, okay? Can you have one bad hamburger every once in a while? You be okay? Yeah, you probably could. You probably could cheat. But you really want to have a healthy diet on the daily basis. And it's the same with your shoes. You want to wear good shoes daily so your feet are comfortable, they're supported, they have the help that they need. And so that's pretty much my take on it. I have plenty of tips and things that I can help you when it comes to shoes. I have patients that come in with luggage of shoes.
Luggage of shoes.
I swear, big suitcases of just shoes, and I'll go over them, over all the shoes with patients because little things like that help.
Yeah.
And, yeah.
Oh my gosh.
Yeah.
I probably have quite a few suitcases. I was just sitting
We'll
there
have to
thinking,
bring them all. Yeah, but it helps. It helps to have somebody look at your shoes and look at your
Yeah.
wearing patterns and look at your feet, do a biomechanical exam, and help you with some tips and things that you can do to prevent issues. So.
Well, that's very
important.
interesting.
Yeah.
Do you see a lot of patients that are dealing with foot issues based on them being runners or joggers?
Absolutely. Absolutely.
Really?
I'm a runner myself. I run a bunch of marathons, 4 marathons.
Really?
Yeah. I'm training for my 5th marathon in Chicago on October 9th. So
Oh my
I see,
gosh.
I've experienced a lot of this myself. I can tell you a lot about it.
I'm from Chicago.
Oh, you are?
Yes,
I'm
I-
excited. I've never done this race. I'm so excited.
It's fabulous. I've not done it. I'm not a marathon runner by any stretch of the imagination, but you will love. Have you ever been to the city?
I have. But
Oh,
for
it's
work, not
gorgeous.
for pleasure or
Yeah.
anything like this. I'm
So you
looking
call a
forward
marathon
to it.
pleasure, huh? No, I'm
I know.
teasing.
Oh, yes.
Oh, God bless you.
Yes.
I'm just like, no, it's a little too
Yeah.
much, you know.
It's fun. It's
Oh.
fun. It's fun to feel the energy of the
Oh
city.
my gosh, the energy. And it's amazing too, because they go along Lakeshore Drive and there's so many people and they're out there and they're rooting for you. They're
Yes.
cheering you on.
Yes.
Oh my God, I can't wait to hear about it when
Yeah.
you come back.
I will. I'll tell you.
Yeah,
I'll tell you
I
how
would
it goes.
love that. I would love
Yeah,
that.
I'll tell you how it goes. So yeah, I have experienced a lot of these issues myself, so I know exactly what to look for. And
You might even be
Sure
able to
was,
pick up some clients there.
yeah, there you go. Seriously, gosh.
Yeah.
Yeah, I think I should be writing a lot more of the things that I see in practice from runners that I don't write it. I should be publishing some of these cases that I see. and Things that could
Absolutely.
definitely help and hope this is a learning project to work on in
Absolutely.
the future.
Yeah, well,
Definitely.
and that would be so beneficial. You
Yeah.
could, blog. Oh, they have this thing now where all you do is talk into, the computer and it writes
Yeah.
everything out for you. I think it's called Dragon or something.
Yeah,
but
the transcript. Yeah,
yeah,
it's great.
That-
I should be working on that. Definitely, That'd be very helpful.
absolutely.
That'd be
So
very
you've got a
helpful.
marathon that's coming up, and how many is that? What
26.2 miles. Yeah.
Oh my goodness.
Excited. Yeah. It's great.
So what do you do for your feet before you do a marathon such as that?
Well, core strengthening is very important, and actually have adequate strength in addition to your regular training is very important. So for my feet, I get fitted for shoes. I don't follow a brand. I don't follow a trend. I get fitted for shoes, and that's very important. Not everybody needs a pair of orthotics. Orthotics are like glasses. Not everybody needs one, but when you need a pair of orthotics, you want them to be custom made, fit to you, especially if you're doing a lot of running or activity level. You have a high activity level. So this is one of those things that I do to keep me going, and it helps. It helps.
That is wonderful.
Yeah,
That is
it helps.
wonderful. What's most rewarding about your practice?
Oh, the worst word. That's a great question. I actually had a pre-med student in my office today, so we talked a lot about that. I think restoring a pain-free life to somebody is the most rewarding thing. When you have a patient that comes in with pain, something as basic, as fundamental as our feet, and they can't function because they can't walk, being able to restore that daily pain-free function is very, very rewarding. And yeah, and a lot of our limb salvage cases are rewarding too. A lot of our diabetics that come in with severe diabetic foot infections, so they already had amputations
Oh,
and
goodness.
things like that. We do a lot of treatment. We do all sorts of different modalities to get them back to a regular daily activities without having any more amputations. So a lot of the limb salvage cases are very rewarding as well.
Wow.
The wound care, yeah, and all that. So-
Well, and expound on that a little bit. Also,
Sure.
what are some of the treatments that you do for those individuals?
A lot of those treatments are are comprehensive. We work with vascular surgeons in the area. We work with endocrinologists, internal medicine doctors, infectious disease doctors. So it's really a team approach to get this, to get a lot of these complex cases resolved. A lot of the things that I do is we incorporate all sorts of technology. Technology is the key, is the new thing. We want to have the newest and latest technology, starting from hardware to skin grafts, and being as basic as fundamental, keeping the basic fundamental principles of wound care, but having the newest technology to help these wounds to heal and to save these limbs. Really, it's amazing.
Wow.
Yeah. So
Because a lot of times it's just been, you amputate and then you get a prosthetic, and that's about it. And now it sounds like,
there's so much to do.
Really?
The technology is great. So there is a lot of advances in wound care and prosthetics too, but a lot of wound care and external fixation, things that we can help patients walk and ambulate while they're having a lot of their advanced care taken care of. So,
Oh, okay.
that's terrific.
Well, I can't thank you enough for coming in, for sharing with us, for educating our audience.
Yes, thanks for having me. Thank you.
Absolutely. And I'd like to thank All County Healthcare for sponsoring this show. And if there are any doctors that would be interested in participating on our radio/TV show, please give us a call at 888-565-1470. We would love to hear from you. And also, you can find us every Tuesday evening between 6 and 7. Call in, ask us questions for our guests. We would love to hear from you. So thank you so very much for being a part of this evening. Any questions that you might have, just give us a call. We would love to hear from you. I'm Lorena Anderson, your life and energy coach. Thanks for joining us.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of the